Researchers at Duke University have discovered amazing weight loss benefits from the product they were studying for brain health. Dr. Patrick Sullivan, professor of medicine at Duke, noticed the weight loss benefits while conducting Alzheimer's research and quickly alerted the endocrinology department for further analysis.
Patrick wisely decided to conduct some of the initial studies in mice looking at cognitive function. He placed the mice on a high-fat diet to induce dysregulation in metabolism to sort of exacerbate that phenotype. That was the serendipity that led us to pursue the metabolic effects of the product in this case.
Over the course of several years, researchers performed exhaustive studies of the naturally derived formula known as NutraMeta.
We did what we call an intervention study, where we had mice that were already overweight fed with and without NutraMeta, and the mice that received the NutraMeta lost weight and didn't gain as much as the mice without the NutraMeta. We've done a number of studies since then, looking at the potential interaction in comparison to a GLP-1 receptor agonist, which you may know is currently the only prescribed therapeutic for obesity treatment at this point.
Preclinical data of NutraMeta was showing results not often seen in non-pharmaceutical products.
GLP-1s are a good start and get people going on a weight loss program, but for the long term, you can't take it forever. This product will help people either replace a GLP-1 or perhaps be a great add-on to a GLP-1 that can be continued after a GLP-1 is discontinued.
We found that NutraMeta caused about equivalent amount of weight loss in overweight mice as a GLP-1 receptor agonist. Really excitingly, we saw that if you put them together, there was additivity between the GLP-1 receptor agonist and NutraMeta. Those are studies that we have now repeated and found the same thing. And we're quite excited to look at the interaction between NutraMeta and a GLP-1 receptor agonist, as well as the long-lasting effects of NutraMeta. Certainly first at the beginning, we're so ingrained that drugs are the efficacious way, and given the number of things that have failed to impact body weight meaningfully, it seems a little far-fetched to think a nutraceutical would have as much impact. But at this point, the nutraceutical seems to be about as efficacious as a GLP-1 receptor agonist.
History shows that people like a safe and effective alternative to pharmaceutical medications, and this product can offer that. And many studies have been done at Duke that show that this product can meet those needs.
What began as a search for a solution for his family health crisis led Prostasis founder Mark Brasso to the discovery of NutraMeta.
It kicked off a 2-year process of me reading 5,000 journal abstracts to figure out how can I reduce 1 million down to 1,000 candidates and 1,000 candidates down to the 5 that comprise the cocktail that we're working with today. In the animals that were administered the cocktail, they had about half of the weight gain throughout the study, and they were healthy at the end of the study. And that was a completely shocking, unexpected finding that we had prevented weight gain in these animals just by administering the cocktail.
Consumers want and demand an alternative to pharmaceutical medications, and nutraceuticals can be both safe and effective for the control of weight.
Our minds are on fire, literally, from excess glucose, from insulin resistance, from toxins that are put in foods, from the good nutrients that are literally ripped from our soil.
And the food industry has conspired to make us all fat and unhealthy. And so what we're hoping to do is, by taking a cocktail twice a day, that they would counter negative effects of the poison that we're eating from our food system and what we're drinking every day.
So the specific cocktail, the specific formulation, the doses that we use, the way that it's coated, the timing of the release, all of this is natural. It's not a chemical that was made somewhere. These are things, if you could eat them in abundance in natural life, you would be able to heal yourself. But it's the specific dose and the way that it's formulated and coated.
So what we're hoping to do is continue to find on-target and off-target benefits. That includes optimizing semaglutide or GLP-1 effects.
NutraMeta has been clinically studied and is proven to be one of the best products in the industry.
NutraMeta's ability to improve metabolic health will be a game changer in the space. While the research team continues to develop and improve their supplement offerings, NutraMeta is set to become widely available in early 2025 in the United States.